health and mental health care, social services, they make up a tremendous portion of our annual state budget. And for somebody who's been in the field as a practicing psychiatrist for over 20 years, obviously that is a special area of expertise. I have been an expert witness, testified in trials hundreds of times. I've been in and around, understand the issues, where we can cut programs, where we can add programs, where we need to stay the same. We don't want to leave anyone behind, but we also definitely have some waste and some maybe ineffective programs, maybe some duplicity. As far as the rural issue, clearly we have a lack of providers. It's difficult. We can't necessarily insist that people practice in certain areas. However, there is a solution, and it's right in front of us, and I wish we would grab onto it. I've been advocating for this for multiple years. There's a group of physicians, actually. They are known as assistant physicians, and that is different from physician assistants. But assistant physicians have actually graduated from medical school, but they are in a category that, because of our lack of residency programs, and for a number of different reasons, people who finish medical school but don't actually complete their residency are in this pool of available providers, but they're kind of in limbo. And they would be ready and able to start practice as soon as we allow them. We do have this program in Missouri, and they are the only practitioners that we can mandate where they practice. Rural and underserved areas are the only places that they are allowed to practice. These folks are talented, they are motivated, they would be an immediate boon to our provider network, and we could put them to work ASAP. I don't know why, as the show me state, we don't show other states why we're not bring those assistant physicians from around the country here and get them to work. Everybody benefits. They would function essentially under a collaborative practice arrangement. So they do have supervision. They have a supervising physician. But like I said, this would immediately improve the availability and the timeliness of care in our rural areas. There's some real world solutions out there ready to be implemented, but we need to go ahead and take that step and make it happen, because there are people that don't have access right now. And absolutely, we need to maximize telemedicine. I was a telemedicine practitioner through the VA. One day a week, I saw patients. I was working in Columbia at the Truman VA, and my patient population was out of Kirksville Outreach Clinic, and I saw patients that way. Then, of course, the rest of the time I was seeing patients in person there in Columbia. But telemedicine is a fabulous option, but nobody in their right mind is going to say that telemedicine is the same as being in person. So you need additional resources, but clearly having a video link is a whole lot better than not having a contact at all. And so again, as long as we have rural broadband, because that's been an issue, getting people hooked up and connected, and there's been a big push. Definitely, I'm a supporter of making sure that that kind of access is available. And then people can use their phone. They can go to a clinic. There's so many different modes that you can access telemedicine, but that's still not having a hands-on in-person provider, which again, these assistant physicians can be. And that just expands the workforce.